was the very informative feature of the day, and with me on set is a doctor from MedBook. Thank you very much, Dr. for making time for us. So Dr. you're going to be talking about Flora app, which is an innovation to the sexual reproductive health sector. So even before we head on to that conversation, kindly introduce yourself to our viewers.
Thank you so much for having me here. My name is Rahab Wanjiro. I'm from MedBook Kenya Limited. I'm the grant lead.
Okay, thank you very much. Dr. on to our topic today. Maybe you would explain to us what is sexual reproductive health, perhaps for someone who is oblivious to the term.
Sexual reproductive health is a state of physical, emotional, mental, and general social well-being. And also in regards to reproductive system. So in this case, someone is able to track their cycle, also to locate a doctor, to know where they can, in terms of the facilities where they are. MedBook Kenya Limited was formed in the year 2014 by a group of Kenyans with a goal to, they just realized that there was a problem. Like patients, when you go to the hospital, you're not able to get your access to your medical records. You cannot be able to book an appointment, and in this case, you're able to book an appointment through the app. So they came up with an app called MedBook app, whereby you're also able to locate a doctor at the touch of a button at the comfort of your home, and you're also able to have your medical records online in your mobile phone. Then through this, we also have other products, that is the Mediclaim. This is also for the insurances, for the claims management. We also have MediHealth that connects the patient with the doctor. So this one also helps the clinic management system, or rather the hospital management system, whereby the doctor is able to treat the patient through the system. And now they also realized that there was a need for the African woman to be able to track their cycles, and this is where now the Flora came in. Flora was born rather, and in regards to
2014 or much later?
Much later. So Flora came about late last year to about now. It's going to be released in the end of this month. By the end of this month, it's going to be on Play Store. So Flora is about sexual reproductive health, and it helps the woman to track her cycle, and also gives you information about sexual reproductive health. So you learn about fertility if it's a woman, if it's a young woman who is trying to track her cycle, and also you're able to see when you can also have your contraceptives. So I can show you how the Flora app works. So here I would have Flora as the app, and we have different profiles. So the different profiles, we cover the parent.
Parent, is it just any parent, the mom, the dad?
So in this case, it's the mom.
Okay.
So we're having the assumption that moms relate very well with the daughters.
Okay.
So we have the parents.
So what happens to people with single dads? Could the dad maybe join as a parent?
Yes, the dad could also join as a parent, but much later on. The app is still a work in progress, so we're still building it as we move along. So we also have the teenager. So you can say the teen.
13
This is the 13 years to 35 years. Sorry, my bad. A teen is 13 years to 18 years. And then we also have the sassy millennial. The sassy millennial is that this is a young woman who also want to track her menses. She also want to know when she's fertile. She also may be trying to get a baby. And we also have the boyfriend. So in this case, the boyfriend is synced to the sassy millennial. So the sassy millennial, with her calendar, so the sassy millennial, with her tracking cycle calendar, she is able to link with the boyfriend. So the boyfriend can be able to see, when is my woman moody, when is she not okay, when is she having her red days, and like when can we have sex? When is it safe for us to have sex? When can we have a child? Because you said for the sassy millennial is that woman who is trying to get a baby, also want to have safe sex, and also she just want to track her cycle. Yeah.
So how does the sassy woman sync the Flora app to the boyfriend? Is it by a number, or what exactly does she
So
use?
so the sassy millennial woman syncs with the boyfriend through the email. So now the boyfriend gives the lady his email address, then now the woman brings him on board. Yeah.
And in instances where they break up, could you unsync the boyfriend if you add another one?
Yes. The worst part is that the boyfriend is not able to sync. I mean, he does not have any option of syncing himself to a girlfriend. So it has to come from the girlfriend giving him the option to sync in.
For the teen?
So now for the teenager, so most of the people right now, most of the teenagers right now do not have access to phones. So how we are planning to do it is a parent who has the phone, who has a smartphone, gets this content in her phone, would want to appreciate the fact that most of our African moms or dads or other parents do not want to talk about sexual reproductive health to their kids. So now, this is how now Flora comes in and helps the parent in this instance. So we give you all the content regarding to sexual reproductive health, how you're able to, what you need to tell your daughter when she starts her menses, how she can be able to track it, and also not to feel ashamed that she's getting her periods, and also how to carry herself around. And we also tell them about the care pack, like you can carry a tampon, a pad, some tissues with you in your handbag and be able to clean yourself when that time comes. That is now the teenager. And also the teenager also gets content, and we also want to impact their lives in such a way that they're able to appreciate themselves as women, and they should not be ashamed that they're getting their menses, and also to let them know that whatever they're going through in their bodies, it is normal, and they should not be ashamed about it.
So when one signs into the Flora app, what kind of details should you key in?
When you sign in the Flora app, your requirements are the email. So if you have a smartphone, you actually need to have an email address. So just key in your email address, you put your age. Your age is going to put you in the different profiles. So now, like now, there's a certain age for a parent, there's a certain age for a 13-year-old, and there's also, the teenager, and there's also a certain age for a sassy millennial. So now, when I put myself as age 21, the app will put me to the content that is for a sassy millennial, not for a teenager.
21, what happens?
So in this case, you'll be considered as a sassy millennial and not as a parent, because the parent in this case, you're looking at this parent who has a teenager. So because now the reason why we are calling you a parent is because you have a daughter who is 13, 14, like that. So now you're able to give the daughter information through your phone. So like when the doctors in the app, they send any information or whatever is happening in the app, the parent just gives the teenager the phone to just check whatever information has been sent. So a 21-year-old in this case would not be a parent. Yeah.
Basically, that's all that is about the Flora app.
Now, another thing about the Flora app is that a patient, or rather the young girls, are able to locate a facility, and that also be able to locate a doctor in the app. So that is the good thing about it. Yes, we also have a locate, which is linked to the Google Maps on where the different facilities are. So in the app, you're also able to book an appointment. So this is how it works. You book an appointment, you see all the time slots that are there. You book, say for instance, you can book from 9 to 9:30, or right now there are no charges. So you book for your slot 9 a.m. to 9:30 a.m. Then you choose the doctor that you want to see. So we have different doctors in there. Then you choose the doctor you want to see. Then the doctor now on his end, he gets a pop-up, or rather an alert message to show him or her, telling them that Rahab is ready for a chat at 9 to 9:30. Then also the doctor is able to prep on his side for the same.
Hold on a minute, Daktari. So we are going to take a slight commercial break, and when we come back, Daktari is going to be telling us more about the Flora app and how much it costs to consult a doctor. I'll leave you with the Digino segment.
What can you do when you've got period pain? The best thing to do is look after yourself. Here are some suggestions. For stomach aches, use a hot water bottle or bag on your stomach to ease the cramps. Take a paracetamol or aspirin. For a headache, take a paracetamol or aspirin. For bloating or swelling, cut down the amount of salt you eat for a few days before your period. For tiredness, take vitamin supplements that include calcium or drink milk. Have plenty of rest and try to get 8 hours of sleep. For moodiness, exercising regularly for up to 30 minutes a day helps maintain a happy outlook on life. For food cravings like chocolate, eat dark chocolate, yogurt, or drink milk.